Welcome. In this video, we'll be discussing pulmonary vein stenosis, a rare and potentially serious heart condition affecting blood flow from the lungs to the heart. We'll explore its causes, symptoms, diagnosis, and treatment options to help you better understand this condition. Pulmonary vein stenosis, or PVS, can arise from several different underlying causes. Congenital PVS is present at birth, often related to abnormal development of the pulmonary veins during fetal growth. Acquired PVS can develop later in life, frequently as a complication following pulmonary vein isolation, a procedure commonly used to treat atrial fibrillation. Other potential causes include lung transplantation, certain inflammatory conditions, and less commonly, external compression of the veins from tumors or enlarged lymph nodes. To understand PVS, it's helpful to know how the heart and lungs usually work together. Normally, oxygen-rich blood travels from the lungs through the pulmonary veins and into the left atrium of the heart. Pulmonary vein stenosis disrupts this process. The stenosis, or narrowing, of one or more pulmonary veins obstructs blood flow, causing a back-up of pressure in the lungs. This increased pressure, known as pulmonary hypertension, makes it harder for the right side of the heart to pump blood to the lungs, potentially leading to right heart failure. The reduced blood flow to the left atrium also means that less oxygenated blood is delivered to the body, causing symptoms like shortness of breath and fatigue. Pulmonary vein stenosis is a relatively rare condition, and precise epidemiological data is limited. Congenital PVS is seen most often in infants and young children. Acquired PVS, in contrast, predominantly affects adults, particularly those who have undergone pulmonary vein isolation for atrial fibrillation. The incidence of PVS after pulmonary vein isolation varies, but is a recognized potential complication of the procedure. The signs and symptoms of pulmonary vein stenosis can vary depending on the severity and number of affected pulmonary veins. Many individuals, particularly those with mild stenosis, may be asymptomatic initially. As the condition progresses, symptoms commonly include shortness of breath, especially during exertion, fatigue, and wheezing. In infants and young children, symptoms may include difficulty feeding, poor weight gain, rapid breathing, and bluish discoloration of the skin, known as cyanosis. More severe cases can lead to pulmonary hypertension, right heart failure, and even hemoptysis, or coughing up blood. Diagnosing pulmonary vein stenosis typically involves a combination of imaging and physiological tests. A chest X-ray can sometimes reveal enlarged pulmonary arteries or signs of pulmonary congestion. Echocardiography, or ultrasound of the heart, can assess heart function and estimate pulmonary artery pressure. However, the gold standard for diagnosing PVS is pulmonary angiography. This involves injecting a contrast dye into the pulmonary veins and taking X-ray images to visualize the degree and location of any stenosis. Other imaging techniques, such as CT angiography or MRI, can also be used to evaluate the pulmonary veins and surrounding structures. While there isn't a formal classification system for pulmonary vein stenosis, it's often categorized based on the cause, either congenital or acquired. The number of affected veins and the severity of the stenosis are also important factors in determining the appropriate treatment strategy. The treatment of pulmonary vein stenosis depends on the severity of the stenosis and the patient's overall condition. For mild cases, careful monitoring may be sufficient. However, more severe cases typically require intervention to open up the narrowed veins. Balloon angioplasty, a procedure where a small balloon is inflated within the stenotic vein, is a common approach. In some cases, a stent, a small mesh tube, may be placed to keep the vein open after angioplasty. For complex or recurrent stenosis, surgical repair or even lung transplantation may be considered. Medications, such as diuretics and pulmonary vasodilators, may be used to manage symptoms and reduce pulmonary hypertension. Currently, there are no specific preventative measures for congenital pulmonary vein stenosis. However, in cases of acquired PVS, particularly after pulmonary vein isolation, careful technique during the procedure and close monitoring for early signs of stenosis may help to reduce the risk. Controlling risk factors for heart disease in general, such as high blood pressure and high cholesterol, is also important for overall cardiovascular health. The prognosis for pulmonary vein stenosis varies depending on the severity of the stenosis, the number of affected veins, and the response to treatment. Early diagnosis and intervention are crucial for improving outcomes. While balloon angioplasty and stenting can be effective in opening up narrowed veins, restenosis, or re-narrowing of the veins, is a common problem. Ongoing research is focused on developing new and improved treatments for PVS, including drug-eluting stents and novel surgical techniques. Studies are also underway to better understand the underlying mechanisms of PVS and identify potential targets for future therapies. These efforts aim to improve the long-term outcomes and quality of life for individuals affected by this challenging condition.